Good evening, Americans. It's Mark Bradley. Welcome to the Wednesday night edition of the Mark Bradley Show. Thanks for watching. Thanks for tuning in every Monday through Thursday night. And don't forget, those updates are always posted on Twitter and Facebook.com right after the show. Email me, markbradleyshow@gmail.com, if you got a question or comment or want to send me a disagreement. Let me know. I may even use it on the show if it's worth talking about. Tomorrow on the show, we're going to comment on what's going on tonight, probably right now as I speak. President Obama's big health care town hall at the White House is going on ABC. Watch it, I guess, if you want to. I'll be watching it later on the internet. Check that out, and we'll have a response for you tomorrow on the Mark Bradley Show. Tonight, I want to go over healthcare, obviously, and explain what I see as the problems and possible solutions. And really, that is the first question: is with healthcare, with approximately 85% of Americans under some form of insurance, what's about the other 15%? Those uninsured Americans. In 2007, it was 41 million of us, and I say us because I currently am an uninsured American. As a younger man, I was insured under my parents. However, now that I am married and living with my wife, she has health insurance. However, the cost was prohibitive at the time, so we didn't get any for me. So I am one of the young, healthy Americans who has chosen not to get health insurance. So, is health insurance the problem? Are doctors the problem? Is it the drug companies? What is the problem with healthcare in general in America? I see two distinct problems. Number one, the problem is too many people think that they have a right to healthcare, that it must be given to them. It's their God-given American right as an American to have healthcare. And that simply is not true. Healthcare is a privilege. It's something that if you want it, you have to be able to pay for it. You have to be able to get it. Now, why does the government seem to think that they have such a vested interest in providing health care or in keeping Americans healthy? Well, a couple of reasons. A healthy workforce is a productive workforce. The government's not going to make much in taxes off of a bunch of Americans who are at home sick all the time. Okay, so they have some interest in promoting health care. Now, do I think that the Constitution provides for that? Absolutely not. When it says promote the general welfare, I believe that that's what it means. It doesn't mean providing welfare. It simply means to create an environment in which people can be healthy and happy and pursue their own health and vitality. And we pretty much have that in America now. If you want health insurance and you're healthy, you can get it for a relatively reasonable cost. The cost for most insurance is not outrageous. It's when you get a little older and have those what they call pre-existing conditions and stuff, then the cost of insurance becomes a big issue. Now, why insurance? Why can't you just pay for a doctor visit or pay for a surgery? Well, that's where part of the problem comes in. That's where the problem number two is. The cost of health care has gotten too expensive. Why? Is it because doctors are paid too much? Is it because administration costs too much? Is it because people are sicker? Why is healthcare more expensive? Well, there's a couple of reasons for that. Look at this. When the government stepped in 60 years ago and started providing healthcare payments for Americans, especially older Americans, as part of Social Security, and then later on we had Medicaid and Medicare came in. What that did was they would all of a sudden pay for things that previously you had to pay for yourself. Well, all of a sudden you could get more stuff, and the government would pay for it. So therefore, demand was increased. Demand for healthcare services went up. This is simple economics. Well, if demand goes up and supply stays the same, what happens? You get a price increase. And that's what happened. Look at this. Tri-State Memorial Hospital in Clarkston, Washington was promoting a few years ago, just over 2 years ago, was promoting their new CT scanner. All over. It was on TV, it was on the radio, it was in the newspaper. They had commercials, advertisements for their piece of testing equipment. Why? Because it makes money. Because it's something that Medicare would pay for, and it's something that they could get, that health insurances would pay for as a preventative. It's a very expensive piece of equipment, but the hospital made money off of that. Well, that's part of the problem. That's not necessary for the health of us Americans to have all these tests and scans. A lady had cancer. She called into a radio show and explained how she had cancer, went to the doctor, and a specialist, an oncologist, and they offered and said, well, you need this test and this test, we need to do this and this treatment, and this is how much it's going to cost. And they said, well, we don't have insurance, we don't have that kind of money. What is that? What do we absolutely need to do so that I can live? And they did it, and they were able to pay for it out of their savings. Now, if Americans had savings anymore, a lot more Americans could do that. And therefore, the demand for those healthcare services would go down, the cost would go down. So there's a couple things we can do as Americans to promote less expensive healthcare. Now, what happens if healthcare is less expensive? Health insurance is less expensive. When you decrease the demand for services, well, here's how we're going to decrease the demand for services. We're going to do it a couple ways. First, we need to get Americans healthier in general. But if we could get away from the television and away from the fast food, America would get a lot healthier. That would reduce the demand for healthcare services, which would lower the cost. Number two, we don't need the government putting money into healthcare and increasing the demand. We need to pull back on those government programs, not expand them, because that's all President Obama is talking about now, is expanding government healthcare to include more people than it did previously. It already covers millions of Americans, whether it's Medicare for older people or under those state children's health insurance programs, the S-chip programs. I mean, we spend billions of dollars every year from the government, your tax dollars, on healthcare. It's already being done, and he just wants to expand it to trillions of dollars. That can't happen. Okay, we've already run ourselves into too much of a deficit. If we spend all this much more money, $1.3 trillion is a conservative estimate on Obama's healthcare plan. That's insane. It's got to stop. But it's going to take Americans getting healthier, and it's going to take Americans taking responsibility for their own health, and it's going to take Americans telling the government to get out of the way. Now, another issue related to healthcare that I think would help also is if we could get that link between the drug companies and the doctors, if we could kind of push them a little further apart, because right now you have drug companies sending doctors, paying for doctors to go to conferences to learn about their drugs and all this stuff. That's not healthy. Americans don't need more drugs. We've got just about enough drugs already. We need more plain old healthy living. And we need more doctors who would encourage that and go with the common sense approach and the more scientific approach instead of putting everybody on a drug as soon as they have a cough. So, cut down on the usage of drugs. Get healthy, Americans. Please. For your own sake, for your children's sake, so that they don't have to pay for you to be taken care of in your older age. You know, who wants that? I don't. I think America has the potential to really turn this around and to make America what it can be. And I believe that the American people understand, at least to an extent, that government can't make you healthy. And that going to the doctor and spending a lot of money and spending a lot of time in hospitals doesn't make people healthy. You've got to make yourself healthy. Thanks for watching the Mark Bradley Show. I'll be back tomorrow night. We'll discuss what Obama said and some of the ramifications of his plan. Hopefully, you enjoy the best of health and happiness. Enjoy the great weather here in our local Lewis Clark Valley. It's great, sunny and warm. Have a great evening. Thanks for watching.